I think the future is very bright, and I'm proud to be part of it.
I'm most proud of the way we interact. We talk about patients frequently, and we're all interested in getting just better outcomes.
Through UT Southwestern, there's nothing that's not available, which is very comforting.
And at UT Southwestern, the doctors manage the care. It's really a different approach to medicine. It really isn't the business model, it really is the healthcare model. I think we're a setting that provides something that's not available in other settings.
Well, much of what we do is the same sort of thing you can find in any hospital in America. We take care of common diseases just like everyone else does. But part of what makes this place special is those people here who have special expertise that you can't find just any old place in America.
Overall, I think huge strides have been made in the past 10 or 15 years in treating stroke. And I think that's come about for a variety of reasons. One, I think people are getting more savvy about their health. Number two, I think critical care in the ICUs and the recognition of stroke as a treatable condition has improved in the eyes of physicians. And then finally, there's new actual therapies for removing clots that have formed and treating stroke. One of the things that we've really worked on improving is smoothly transitioning people from one area of the campus to the other. We had a patient just a couple of weeks ago who was smart enough to show up to the emergency room within an hour or so of the onset of his stroke symptoms. And then the doctors in the emergency room over at University Hospital St. Paul recognized that, and they called us in the neuroradiology suite, and the patient was transported directly from the emergency room at St. Paul to the angio suite at Zale, and within an hour or so of being on the campus was receiving his treatment for his stroke.
Well, our program is all about giving excellent care to patients with hematologic malignancies, basically cancers of the bone marrow and immune system. And a lot of our patients actually do end up getting bone marrow transplants. Coordinated care ends up leading to very good results for the patient. So actually our treatment-related mortality and long-term survival results are among the best in the country.
When you have a teaching hospital, a university hospital, from bench to bedside and sometimes bedside back to bench, and then refining your techniques and refining your treatments, I think is the strength of this institution. We have the expertise, both surgical and medical. We have the infrastructure to carry on liver, kidney, pancreas transplantation. We have a significant amount of hepatology presence in our institution, with different areas of expertise, going from acute liver failure to liver fibrosis to autoimmune hepatitis to hepatitis C, hepatitis B, and non-alcoholic steatohepatitis. It gives our center a lot of strength when it comes to full care of liver disease, and including liver transplant as an arm treatment for those.
This is one of the only academic medical centers that had heart-lung transplantation that did not offer the abdominal transplantation. So it's a natural step, it's a real logical step for the university to want to include the abdominal transplantation, which is the liver, kidney, and pancreas.
You know, they saved my life, but they also gave me a life that I didn't have before. You know, living in Houston, there are a lot of people, you know, that say, how did you end up in Dallas? It's a massive medical center down here in Houston. I ended up in Dallas because that was really the right place to be.
We've always had good physician talent. We've now put those physicians in the same working environment, so that cardiac surgery, vascular surgery, cardiology, interventional radiology, and pulmonary medicine are all really functioning in the same environment. So instead of patients having to sort of go around and see all those people, they can now go to one sort of common area where they can be seen by all those physicians, have their procedures performed by a group instead of a single physician, and just facilitate those interactions. That's led to good research opportunities as well as better patient care.
In addition, we are adding new methods of assessing heart function using cardiac ultrasound, and referring more and more patients for advanced CT imaging of the chest. We can see things down to the size of 1 to 2 millimeters and are actually able to look at coronary vessels with those techniques.
Defibrillators, and it paced me out 84 times without the shock. So that's 84 times that I would have been dead. Even the 15 times that it shocked me, that's 15 times that I would have been dead. Technology is wonderful.
So happily, I'll be cardioverted tomorrow afternoon and start my life again. But I have seen everybody in the cardiology department, I think, at one point or another. They have all been so kind and have had input. The cardiologists all were in the room at the same time, and we discussed what we wanted to do, and they were in agreement.
Two-step.
I've been practicing emergency medicine for 34 years, and it's only since we aligned with UT Southwestern that I've had this kind of an information system available in an emergency department. And I wondered, golly, how many things did I miss before? There's nothing that's not available, which is very comforting when you're an emergency physician, to know you have that kind of backup and those kind of resources that you can call on.
Our patient satisfaction results have gone from the 60th percentile to the 90th percentile in 6 months. You can have all the book smarts in the world, but if you can't relate to people, you really don't need to be in healthcare. Because you got to be able to get on their level and really talk to them and understand what their needs are and understand what's worrying them.
I just let them know just to make sure, okay?
We have 3 parts to our spine center. We have an academic component that teaches. We have an academic component that does clinical and applied research. And we have a part that offers the very best clinical base for patient care. And it's in an academic setting that allows us to really look at the best medicine available.
We are setting up metrics to have a standard, but we want to meet and exceed that standard on a daily and monthly basis in the spine center. Again, it goes back to the patients have a choice in their health care, and we want to be their choice for their spine care at UT Southwestern.
The goal is for us to be the academic medical center that people think of across the country when they're asked the question, where is the best place to go to get care?
The robot has been developed specifically to do a better job on doing a radical or total prostatectomy for men with prostate cancer. And what it simply is, it's a device that helps a surgeon to do a better job in getting to the prostate, a better job on taking it out, doing it more safely, sparing the nerves that are responsible for a man's erection, and restoring the normal functionality quicker.
The laparoscopic surgery has really been a tremendous thing. It's made the decrease of pain, the length of stay decrease, and it's really been exciting for that to expand.
We've had patients that came in completely in a coma, and we were there when they woke up. We worked with them for 9 months, and they were able to go home, graduate from college, so that's exciting.
Teamwork is very good on our unit. In order to have a patient go from what I would call a blank canvas to a complete canvas, which is essentially what we do, it has to rely on teamwork. It involves communication amongst all disciplines, physical therapy, occupational therapy, speech therapy, nursing, as well as the physicians, in order for everyone to be on the same page so that we can all reach the same goal. It's very high on our unit.
I would get a lot of headaches, a lot of them. And then I had bleeding in my brain. I went into a coma, and I'm gonna have surgery soon. I'd say it's a very good hospital. They have great nurses, they have good doctors, they have good therapists, and they're all willing to teach you to be like how you were. And I've appreciated every single one of them.
And at UT Southwestern, the doctors manage the care. So there isn't someone telling me, oh, their insurance says this, or you can't take care of them in that way because we're trying to maximize our profits. So it's really a different approach to medicine. It really isn't the business model, it really is the healthcare model.
Well, no patient is cared for by a doctor alone. It's always a team. Functions well, patients get the service that they need. And that's what makes this place special, is the team that works together, communicates well, and fosters a collegial environment. It's one of my favorite things about being here.